The hugely popular drug Ozempic is dominating the drug market and could soon spread even further. Testing is underway to get the injectables approved for young children. Ozempic and Mounjaro manufacturers testing weight loss shots for kids as young as 6 who suffer from obesity. Close to 15 million kids nationwide are considered obese. That's nearly 1 in 5 American children. There are several major headlines this week when it comes to Ozempic and similar drugs, so we're welcoming in Dr. William Li, physician scientist, author of Eat to Beat Disease. Doctor, thank you so much for joining us.
Thanks for having me on, Natasha.
Let's start with the testing getting underway for drugs like Ozempic, approved for kids as young as 6 years old with obesity. Do you feel this is a good idea, and why?
Yeah, well, first of all, it's really important to understand that these prescription weight loss drugs called GLP-1 agonists are actually originally developed for diabetes, and they actually work for both adults and children. And so there's a lot of experience on the effectiveness and safety. And in fact, studies in adults have shown that these medications can lower the risk of cardiovascular disease as well. The discovery that they can actually help to lose weight is actually quite significant in the sense that there are so many people who do actually have true medical needs. They're in jeopardy if they actually can't lose weight in any other way. And so for those people, whether they're younger or whether they're older, these prescription weight loss drugs have represented a breakthrough. The question is, how young should you go, and what are the people that really need to have them versus the people who just want to have them? That, in terms of the younger side, that's what these clinical trials are designed to answer.
I appreciate that. And I do want to ask you, too, just this week, Eli Lilly's new drug to treat obesity called Zepbound was approved by the FDA. And in trials, it helped people lose up to 52 pounds in 16 months. The FDA approved this for obese adults with at least one weight-related condition. Eli Lilly says it'll be more than $1,000 a month in terms of cost. That is too expensive for most Americans. Do you expect insurance will fight covering this?
You know, the popularity of these types of drugs has really eclipsed our knowledge of actually how safe they should be over time. And so we're just beginning to find out beyond clinical trials and real world applications, what is going to happen for the long term. When it comes to the cost, they're expensive. They need to be injected once a month. And when people stop using these drugs, they tend to gain most of their weight actually right back. And so I think that what needs to happen is that the medical community needs to just step up to take the responsibility to work with patients, and for the younger people, minors, to work with their parents to really try to decide, do they need these medications? And by the way, these approvals are all for weight loss are all in conjunction with diet and lifestyle changes. And at the end of the day, that's what we actually need to be able to enforce in people who want to live healthy and well, and with weight control, is diet and lifestyle matter.
Yeah, and certainly we can understand the massive interest in this. So many Americans have struggled for so long with this. And I do want to point out there is a brand new study, I think it's just out yesterday, showing Wegovy cut the risk of heart attack, stroke, or death from cardiovascular issues by 20% among those with heart disease. Why is this significant?
Yeah, these are the big killers and the big kinds of chronic diseases in our society. And so we've always in medical research been looking for better ways to actually lower risk and improve outcomes. The question is, given the popularity of these medications, who really deserves and needs to actually have them? Right now, I think the interest enthusiasm outstrips our ability to actually control them. And that's why people with diabetes, for whom these drugs were originally developed, are having difficulty even accessing them for the treatment of diabetes itself. And so I think we need to yoke back a bit of our enthusiasm and understand that the clinical trials give us guidelines, and doctors need to be able to provide guidance to follow these guidelines so that the people who need them are actually able to get them.
Okay, Dr. William Li, appreciate your time. Thank you. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.